All right, we're back with another cosmetic close-up. This time we are interviewing Dr. Thurston. So excited to have you.
Hey, Mary, thanks for having me today.
Absolutely. Right. So first and foremost, all these surgical words can get a little hairy sometimes. So what is a rhinoplasty?
It's a good question. So rhinoplasty is commonly referred to as a nose job.
Okay.
It comes in a couple different forms. There's open rhinoplasty and closed rhinoplasty, and depending on what your nose looks like and what you're trying to achieve with it, as well as how well you breathe, it determines whether you're a candidate for open versus closed rhinoplasty.
Awesome. All right, Dr. Thurston, so why would someone come to you and get a nose job? What are the reasons?
So the top three reasons really come down to whether or not they can breathe. That's the top issue. And then within that, some people are concerned about the hump on the back of their nose or the shape of the tip of their nose. And those are the big reasons they come to see us.
Okay, and how long does it take you to do a nose job?
So you're asleep, but typically it takes about anywhere from an hour to 3 hours, depending on the amount of work that has to be done on the nose. The more work that we have to do to remove a dorsal nasal hump or adjust the tip, the longer that's going to take.
Okay, and then how long of a recovery time process is this?
Recovery is realistically about 2 weeks. The first week, you hate yourself for having the surgery because you're bruised up and your breathing's a little bit more difficult.
Yeah.
And the second week, you hate me because you're still bruised up, but you feel better and you look better. After about 2 weeks, you're ready to go back out in public and get back to work and get back to your normal life.
Cool, awesome. So overall, how uncomfortable is the post-procedural for this?
I was joking a little bit before. It's not the worst day of your life.
Okay.
The biggest risk of discomfort is really the post-operative dressing. The procedure itself is not particularly painful, and you're not particularly feeling a lot of headache or pressure in the nose. Really, the discomfort comes from the fact that you're wearing a splint on the outside and the inside of your nose. It really affects your breathing. It makes you feel like you have just the worst cold for about a week and a half to 2 weeks.
Okay, all right, cool. So is every rhinoplasty patient going to expect to breathe better afterwards?
Most rhinoplasty patients do breathe better afterwards. In terms of a functional rhinoplasty, for people that come and see us for breathing problems, they all do better. Awesome. In terms of patients that are coming just to do a little adjustment to the tip or take a dorsal hump off, it's not an operation designed to help them breathe better, but they also typically feel better about the breathing.
Win-win. So scars, Dr. Thurston, what are we looking at for scars?
In the biggest operation that we do, there'll be one little incision right on the bottom of the nose, the part called the columella. It separates one side of the nose from the other, and it's not visible unless you're looking directly underneath someone's nose.
Nice. Dr. Thurston, thanks for joining us. I learned so much about all kinds of different noses, rhinoplasties. It was great.
Thanks for having me, Mary.
Absolutely. So check us out next time for our next cosmetic close-up, and check out the link below at our website, Refined Looks, for more.